Welcome. My name is Ron Clark, and I'm an orthopedic surgeon from the Bone and Joint Center of Yuma. You might be asking yourself, what is an orthopedic surgeon? Well, it sounds sort of like maybe someone who keeps your teeth straight, or maybe someone who takes care of children. Actually, the word orthopedic means both. Ortho means straight, and pediatrics does mean children. So why would you want to have someone straighten your children? Well, for all those parents out there, fortunately, we don't have the terrible disease called polio anymore. But back when orthopedics was developed as a medical science, orthopedic surgeons were the surgeons that took care of deformities caused by polio. Today, orthopedic surgeons take care of bones, joints, ligaments, muscles, tendons, and cartilage, even your spine, keeping them in good working order. In order to become an orthopedic surgeon, it takes years of training. First, an undergraduate degree in college, followed by medical school, internship, residency, fellowship, and then before you can become a board-certified orthopedic surgeon, you must practice for at least 2 years before you can present your academic credentials for certification. Now, an orthopedic surgeon is not someone who just does surgery. An orthopedic surgeon is someone who takes care of a wide range of conditions and treatments related to bone and joint health. So, for example, I might use an X-ray. I might use an MRI scan. I might use an ultrasound. I might use physical therapy. I might use all kinds of different medicines in order to take care of someone who's experiencing bone, muscle, or joint pain. Now, one of the common joints that we take care of in orthopedics is the knee joint. The knee joint is something that we're all familiar with because we all have 2 of them. The knee joint is a composition of 3 particular bones: the thigh bone called the femur, the kneecap called the patella, and the shin bone called the tibia. We learned long ago in medicine that if you give bones special funny names, they'll probably pay you a little bit more in the office. But joking aside, these bones form the transmission of the body, helping us get from place to place. So what makes a joint special? Well, on the end of the joint, we have a special substance called articular cartilage. That tissue is smooth and easy to move. And then holding the bones together are special tissues that we call ligaments. A ligament is a piece of tissue that connects 2 bones together. And then in the knee joint, we have a special type of tissue called the meniscus cartilage, or the rim cartilage. Let's take a look inside the knee joint so we can see what these structures look like. This is a video inside a knee joint, and you can see the kneecap coming down to touch the thigh bone. Look how the cartilage is smooth and glistening. It's even, and it's in perfect condition. We'll move the telescope along the outside of the knee joint towards the back, and now we're going to see a tendon coming up from behind the knee from the shin bone. We'll move the telescope forward into the center of the joint, where we'll look at the front stabilizing ligament called the anterior cruciate ligament, or abbreviated ACL, right there in the center of the screen. Now we're going to put the telescope between the 2 bones on the outside of the knee joint so you can see the thigh bone above and the shin bone below. Between the 2 bones is the outside meniscus cartilage, which sometimes can be damaged. We'll move the telescope now to the inside part of the knee, and we can look at the joint surfaces here because they're shaped a little bit different. Now you can see the thigh bone above and the shin bone below, and the inside rim cartilage. So that's what a normal knee joint looks like. So what could go wrong? Well, people fall down and injure themselves. Sometimes they run too much and they get injuries from too much activity. And then unfortunately, years take their toll and we can have problems related to injuries over the time. So let's take just a look at our knee joint here and look at the different structures inside. As we look inside the knee joint, we see the joint surface, we see the stabilizing ligaments, and then we see the rim cartilage. The rim cartilage is perhaps the most commonly injured structure that I see in orthopedics. It happens to young people as well as it happens to people in the middle ages or people of advanced years. By taking care of these knee rim cartilages, we can help people who are experiencing pain. Using the joint telescope is an easy way of taking care of knee joint problems, and by using the joint telescope we can get people back to health quickly. One of the problems that people have after knee joint surgery is joint stiffness, so we usually send people to a physical therapist so that they can get their knee to work perfectly straight and perfectly bent without any pain at all. Thank you for tuning into this segment of Joint Health Learning, and we look forward to telling you more about the knee joint and other joints in future segments.
Keep moving forward and continue enjoying your life independently. You may be getting older, but who says you have to start slowing down? The Bone and Joint Center of Yuma. Experienced, compassionate care.
Hi, I'm Dr. Ron Clark. At the Bone and Joint Center of Yuma, we offer experienced, compassionate care, and I look forward to helping you with your bone, muscle, or joint problem.